It is a widely held belief in dentistry that if a tooth is extracted, that the opposing tooth will supraerupt or grow or elongate into the space left by that extracted tooth. So it is essential to replace that tooth so this does not happen and lead to future more serious problems. Supraeruption does indeed occur, but after 42 plus years of practice, I can honestly say I do not see it as a common observation and should not be a major determining factor, certainly not the only factor when deciding to replace a tooth, especially second molars. These are the molars right in front of the wisdom teeth. I rarely see a patient who has lost a second molar and truly misses it. Here is an example of a patient who had the lower second molar extracted many, many years ago, and the upper second molar has barely moved. What I believe happens is that the muscles of the cheek and the muscles of the tongue enter that space and help keep that tooth in position. So here's a study done in July of 2021 that showed 0.7 to 1.2 millimeters of movement, pretty minimal, in 47.5% of those studied, with a higher degree of movement in the younger age group, which makes sense as the bone is still maturing. The study recommends careful diagnosis and measurements over time as an essential, useful, and significant step before treatments for replacing a missing tooth or teeth are considered. Sounds like a very reasonable approach, and photographic documentation and study models are an excellent and essential way to monitor position of teeth over time. Of course, there may be other even more significant reasons to replace a tooth, such as having difficulty chewing, or the tooth or teeth may be in a position that is affecting speech or affecting the smile. And remember, if movement or supraeruption is observed and needs to be controlled, and a tooth replacement cannot be done for what could be a number of really good reasons, a simple removable orthodontic retainer worn at night is often all it takes to keep that tooth position stable over time. For more information about other dental topics and to better understand the holistic philosophy and approach to addressing these problems, visit www.holisticdentallearning.com.